Hi everyone, my name is Abril Galicia and our presentation is on Willow Preschool, and it is a school-wide implementation of functional communication training on ASL signs with gestures and visual schedules.
Now, I'll introduce our group members and tell you a little bit about each of us. My name is Yeme Camacho. I am an RBT located in Miami, Florida, with clinic, school, and in home experience servicing 3 to 15-year-old individuals who have been diagnosed with ASD. I'm currently completing my master's in ABA at Ball State University. April Galicia is from Naples, Florida. April has been an Willow Preschool serves 250.
As seen in this picture, children visualize things better when someone is modeling them. Now, how can this help us with our intervention strategy? Next, you will be hearing about visual schedules and ASL signs or gestures.
A little background on functional communication training skills. It can lead to a decreased frequency of maladaptive behaviors. Evidence has shown that functional communication training is used as a replacement behavior, replacing the maladaptive behavior with the communicative behavior, either verbally or through a different communication device. This can be done with sign language, ACC devices, and PEC systems. Here at Willow Preschool, we will be using the sign language to address maladaptive behaviors through FCT. What are visual schedules and how can they be used in combination with sign language and gestures? First, we'll talk about visual schedules and how they enhance the receptive language and assist students in the classroom. According to Garrison, he demonstrated that students can attend to visual information more successfully than having to process lengthy verbal requests. Visual schedules assist with comprehension and provide another channel for learning and are easily accessible should a student need to be reminded of the day's events. Recent research confirms that shifting from verbal prompts to visual prompts can increase a student's independence and engagement, as well as decrease the need for adult support. ASL, also known as sign language, which serves as a form of communication, is accessible without any extra materials. ASL provides a faster and easier way to communicate by learning the core words in sign language so that a student can interact with each other more effectively. ASL has been shown to be effective with preschool children in communicating their wants and needs by just using their hands in more ways other than pointing. Implementing ASL across the school will allow everyone to use the same gestures to get what they need instead of the target behaviors.
The materials needed for this intervention implementation are the following. First, for ASL, we're going to need ASL core language flashcards, laminating tool sheets, a printer, access to internet data sheets to keep track, and the staff to perform the implementation. Then for visual schedules, we would be using similar materials which include access to internet, laminating tools and sheets, a printer, pictures of visuals, boards, Velcro, data sheets to keep track of data, stuff to perform implementation, and toys or play area where we can observe the student.
In order to apply our interventions, we will be using our ABA guideline, which includes most to least prompting. To apply this strategy to our intervention, which increases the pace of instruction and creates errorless learning, where the student learns the correct response immediately before having the ability to learn it incorrectly. By using physical prompts, we can facilitate the learning and transition of multi symbol messages. The steps for implementing most of these prompting for visual schedules in ASL include the following. Step 1, we will secure the student's attention and deliver the discriminative stimulus, also known as the SD. Step 2, the instructor will use a physical prompt to help the student display the correct ASL response and promote errorless learning. Step 3, we will have several sessions of this errorless learning, and then we will move on to the following prompt steps. We will make sure that the students master the previous step before moving on to the next step, which is our step 4. And step 5, the student will be moving visual schedule without any help for the activity.
To implement our interventions, we're going to need data sheets to collect data for each day. First is the behavior data collection form, where we are going to track the behaviors and the antecedents for their consequences. This will show us the intervention is working. We also have a ABC data form that we're going to utilize to figure out the function of their behavior that we're going to track. Here we also will have a visual schedule that we're going to implement in the classroom, which will show the students what group they're in that day and what rotation they will be in. And their group rotation will be for 10 minutes, and each rotation, once the timer goes off, they will rotate groups. How to implement. The implementation process will also include different strategies that will be done by modeling and role-playing the interventions during circle time and playtime. Modeling will set clear expectations and provide students with visuals on how to effectively communicate their needs or want to their peers through ASL. Students will demonstrate they understand how to make the request for a toy, ask peers to play, and how to follow a visual rotation schedule. The students will be given immediate feedback during the modeling and role-playing phase, so they will understand the expectation prior to having playtime. Today I will be demonstrating a modeling strategy using American Sign Language, which is ASL, with some of our nonverbal students who have challenges with asking to join in or asking their peer to share. The two American Sign Language strategies that we will be utilizing is share, which is demonstrated like this, and please, which is this. So share, please. Share, please. Share, please. Good job. Let's practice again. Share, please, please. Good job. Share, please. Good job. Try share. Good job, please. Awesome job. All right, so you did a wonderful job asking. So let's try it again, and then you'll get the opportunity to play. Ready? Share. Share. Demonstrate. Share. Please. That's please. That's share.
Do it. Share, please. Good job.
The implementation of ASL gestures and visual playtime schedule rotation is vital in helping students learn a more effective way to communicate their needs and wants in a positive way. This way, the students are not throwing tantrums or fighting for toys they want during playtime. The visual playtime rotation schedule will allow them an effective way to learn how to share by rotating items during play and downtime. All students will be rewarded for displaying appropriate social and playing skills. By using basic ASL and visual playtime schedule, students will learn new replacement skills rather than fighting. As a result, the students will learn how to request a toy and follow a visual playtime rotation with timer. I'm going to take you through an overview of our implementation plan. The school houses several employees with varying backgrounds as well as parent volunteers. For this specific intervention, the principal, the classroom teacher, and 2 assistants, volunteers, occupational therapists, physical therapists, as well as a speech language pathologist will be used. This team represents multiple and diverse perspectives to co-create the systems and practices for support in the classroom. This team is responsible for uncovering strengths and needs by monitoring the school, community data, and ensuring students receive equitable access to supports and evaluating overall effectiveness. The need for change. During playtime in every classroom, there are 2 recurrent behavioral concerns that need to be addressed, which includes fights over toys and tantrums. The majority of the time, the issue arises when one student takes a toy away from another student without first asking for the toy or permission to play with the other student. The children will frequently fight as a direct consequence of this, and 1 or more students will have tantrums. The school needs a way to address the constant struggle between the students by offering an intervention that helps children of different communication levels best communicate their needs and wants to others as well as adults. Currently, Willow Preschool houses several practices that will facilitate implementation. Teachers have access to building and classroom-wide technology, including laptops, printers, materials such as paper and laminators, and programming to create visual schedules for each student and the classroom. These visual schedules will be given to each student and expected to stay at their desk or table or transported with the student, which will help teachers, assistants, and volunteers be able to prompt the students to use or reference them. Teachers, assistants, and volunteers will need to attend a training before student use. Potential barriers that may arise during the pre-implementation include visuals needed for each visual schedule and possible destruction of materials. Teachers and assistants may have difficulty finding or taking pictures of each toy or activity to put on the boards. Students may not understand if they are not real pictures of what they will be doing or playing with. Because of the young age of the students, materials may be ripped or destroyed at the onset of implementation. Extra pieces and materials may be needed. Students spend the majority of their day within the classroom settings. It is critical that the expectations in the classroom align with the broader school-wide systems. This consistency supports better behavioral outcomes for all students. Teachers and students co-design agreements and routines that align with the school expectations. Each student will be given a visual schedule as well as an ASL start kit starting at the beginning of their day to outline their expectations what will be for playtime. Once each expectation has been completed, it will move from the green to-do zone to the red completed zone after the teacher instructs them to do so or it is moved for them. This will be available on iPads for students who use them throughout the day. Willow Preschool has the capacity to implement these strategies throughout the school. Teaching basic ASL and implementing visual schedules for playtime can be easily done with the resources the school already possesses. Visual schedules and the use of ASL can be used as a Tier 1 approach for all students at Willow Preschool. Tier 1 systems, data, and practices support everyone across all settings. They establish the foundation for delivering regular, proactive support and preventing unwanted behaviors. Tier 1 emphasizes modeling, teaching, and acknowledging positive social, emotional, and behavioral skills. Teams, data, consistent policies, professional development, and evaluation are essential components for these practices to work effectively. Teaching ASL to classrooms with nonverbal students will be of higher priority. The use of visual schedules for playtime and rotations for work time will be implemented in every classroom to help communicate appropriate time to play with certain toys and when to work on school-based activities. For the installation of using basic American Sign Language and a visual play schedule for rotation, no funds will be needed to help students learn how to communicate their needs and wants during playtime. The basic ASL flashcards, ASL video demonstration, and visual play schedule materials will be provided by clinicians. The videos will be played from a teacher's computer. Students will be introduced to these interventions daily during center time by the clinicians and teachers, so no additional costs will be incurred. If additional training is needed for the parents, volunteers, service providers, or administration, this will take place after school prior to staff end time. There will be no startup costs due to the school providing the needed materials and due to the training happening during the school day. The needed materials will include the following: school printer, school paper, school laminator, school internet, school folders, and school toys. For the parent and community involvement, the clinicians and teachers will have a parent meeting with the parents prior to implementing the new interventions to the students. This meeting will be held on purpose at school. However, if some parents cannot attend, we will also offer a virtual link for them to participate. The purpose of this meeting with the parents is so they can be involved as well with helping their children utilize the new interventions at home as well. The clinicians and teachers will provide the parents with a detailed breakdown of how these interventions will be introduced and implemented. The clinicians and teachers will practice the interventions with the parents and provide them with a folder with ASL gestures and the visual schedule. The goal is for the students to be able to utilize these interventions in the school setting and their home setting with fidelity. The goal is for these interventions to decrease tantrums and fighting, and also the students communicate their wants and needs. When the parents take their child or children out into the community, they can teach their child or children how to ask or request for something using ASL gestures. This will be an effective form of communication between the parents and their child or children. Parents can share this with the teachers and how their interventions are going within the home setting and in the community.
In terms of implementation tips,
Thank you for listening. This concludes our presentation. And as you see, here is our reference page for all the information that we use during our presentation. Thank you.